Yes, boys. Should I start? Okay, thanks. Now today I will talk about the cerebrum. Cerebrum is the largest part of the brain, and this largest part of the brain is oval in shape, or you can say oval, and this oval in shape largest parts consisting of two cerebral hemispheres. The two cerebral hemispheres, they are partially connected with each other. As you have seen in the DH, most of the table we have shown that cerebrum, which is consisting of two cerebral hemispheres, these two cerebral hemispheres, they are partially connected with each other by means of corpus callosum, which you can see in the medial longitudinal fissure. Alright. Each cerebral hemisphere, they are surrounding from peripheral side or outer side to the inner side by the cerebral cortex. The cerebral cortex is consisting of grey matter. So we can say the cerebral hemisphere are surrounding outside by the grey matter. In the inner part of cerebral hemisphere there is present white matter. The case is just reverse of the spinal cord. In spinal cord you have read that grey matter is S-shaped. Surrounding the grey matter there is the white matter. But in case of cerebrum, the case is reverse. The grey matter is forming the cerebral cortex and white matter is present in the inner parts. Second thing, in the white matter there is presence of masses of the grey matter. I am using the word masses of the grey matter. That means when we see the white matter of the cerebral hemisphere, you will find there the grey matter patches. These masses of the grey matter inside the white matter are called basal ganglia. They are called basal ganglia. So what is the basal ganglia? These are the grey matter masses present inside the white matter of cerebral hemisphere. You will read next class the basal ganglia. So your mind should be clear that what is the basal ganglia. These are the grey matter masses, not complete one. These are the grey matter masses present inside the white matter of the cerebral hemisphere. Alright. Then the other point comes, get inside quickly, go back. Don't stand here, go back, sit down. And try to come in time. Next point is that the cerebrum is having the cavity. The cavity of the cerebrum is called lateral ventricle. So both of the cerebral hemisphere, they are having their cavity, that is lateral ventricle. After knowing these things, when we see the cerebral hemisphere, as I use the word oval in shape, so look, this is the different poles. This is one, anterior side, and side temporal pole. That means each cerebral hemisphere is having the three poles: frontal pole, occipital pole and temporal pole. Next thing, This is called superolateral surface of the cerebral hemisphere, and one is medial surface, and third is inferior surface of cerebral hemisphere. So we can say cerebral hemisphere is having the three poles, three surfaces and three borders. What are the borders? Look at. Just guard with mask. Get up. Get up and leave the class immediately. I don't want you to see again. Get up. If you are not interested, don't come. Leave the class immediately. Once I see the face, I don't like to see again. Get up! Don't waste my time. Give our passage. It is having the three borders. The borders are, look this one. This is called superior-medial border. And look this one, downward, that is called infero-medial border and infero-lateral border. That I will show you the another diagram. Look here. This is the inferior surface of the cerebral hemisphere. On the inferior surface, when we see there are the two borders. Look this one. This is the infero-medial border and this is the infero-lateral border. So three borders. One is the superior-medial border and two inferior border. This one. After seeing this, when we see the surfaces of cerebral hemisphere, and we have discussed many times that surfaces of the cerebral hemisphere are not smooth. They are showing invagination, and between the invaginations there is raised parts. Raised close to it. The invagination parts of the surfaces of cerebral hemisphere are called sulci, and the raised part between these two sulci, that is called gyrus. Then the question may ask you, why the necessity to why don't the surface become smooth? The reason is to increase the surface area of the cerebral hemisphere. To increase the surface area of the cerebral hemisphere, the sulci and gyri are present. That is the answer. Alright. These sulci and gyri, out of many of the sulci and gyri, first of all I will talk the two important sulci and gyri. For that, this is frontal pole, this is occipital pole. On the superior-medial border, I don't want any murmuring. Try to understand. This will help you after becoming doctor also. Try to understand. No, please, leave the class. Close the gate. So, on the superior-medial border, take a point, midpoint between the frontal pole and occipital pole, and mark the midpoint. First point, how you be identify the sulcus, that is central sulcus, is very important. For identification of the central sulcus, take a midpoint between the frontal pole and occipital pole, where on the superomedial border. Okay, just 1.5 to 2 centimeter behind this midpoint, a line which is passing forward laterally on the superolateral surface downward. Look this line. That is the central sulcus. I am repeating again, central sulcus. For the marking of the central sulcus, first point is take the midpoint between the frontal pole and occipital pole. Point. A line passing downward laterally on the superolateral surface, reaching just above the another line, that is the posterior MS of the lateral sulcus. Just reaching above the posterior MS of the lateral sulcus, this is called central sulcus. This central sulcus is also extending slightly on the medial surface, that I will show you on the medial surface. Try to understand, central sulcus is also reaching just 2 centimeter, or maybe there is no fixed point. It is also reaching on the medial surface. This part is called central sulcus first. The second sulcus which we will consider is the lateral sulcus. Look this part. The lateral sulcus, it begins on the inferior surface, that I will show you again when show you the inferior surface of the cerebral hemisphere. On the inferior surface of the cerebral hemisphere, the stem of the lateral sulcus is present, and this stem of the lateral sulcus come on the superolateral surface. As it comes on the superolateral surface, it divides and giving the rami, A, anterior ramus, this one, B, ascending ramus, and C, this one, this is posterior ramus of lateral sulcus. So, these two sulci are very important. One is the central sulcus that we have talked, and second is the lateral sulcus. The lateral sulcus, which begins on the inferior surface of the cerebral hemisphere, it comes on the superolateral surface, and as it comes on the superolateral surface, it is dividing into 3 rami: the anterior ramus A, ascending ramus B, and posterior ramus of the lateral sulcus. See the diagram. Which one is longer? Posterior ramus. A and B are very small. The posterior ramus of the lateral sulcus is more longer. After this, so these two sulci and one more sulcus, we will medial surface of the cerebrum. On the medial surface, this is the medial surface of the cerebrum. Look here, what is this? This is the corpus callosum, and look the posterior part. Here, there is the parieto-occipital sulcus. Parieto-occipital sulcus, and this parieto-occipital sulcus is reaching up to the superomedial border, starting on the medial surface just below the splenium. This is the part of the corpus callosum called splenium. Just start below the splenium of the corpus callosum, reaching to the superomedial border, and also come on the slightly on the lateral surface. Look here. The parieto-occipital sulcus, which begins on the medial surface and slightly comes on the superolateral surface. This one. This is parieto-occipital sulcus. What is this? Occipital pole. When we see the inferolateral border, this is the inferolateral border of the cerebrum, just anterior to the occipital pole, on the inferolateral border, there is a notch. You can see here, but not so clearly. This one, this is called parieto-occipital notch, pre-occipital notch, pre-occipital notch. I am telling you this thing because they will help in different lobes of the cerebral hemisphere. We know the pole, we know the borders, we know the surfaces, but the cerebral hemisphere is also dividing into the different lobes: frontal lobe, parietal lobe, occipital lobe, temporal lobe. So for demarcation of the lobes, we require these sulci and imaginary line. Now I am telling you about the two imaginary lines. As we know, this is the parieto-occipital sulcus. Okay, and here comes the part of the pre-occipital notch. A imaginary line, I am using the word, for differentiating the lobes of cerebral hemisphere. We consider the two imaginary lines. The first imaginary line extending from parieto-occipital sulcus to downward to the pre-occipital notch. This is called first imaginary line. This is not so hard. You can understand. From this parieto-occipital sulcus to the pre-occipital notch, this is the first imaginary line. And second imaginary line, this is the posterior MS of the lateral sulcus. Continue this posterior MS of lateral sulcus to the first imaginary line. That means up to this part, like this. You can see the color, the green color. And after considering the two imaginary lines and the sulci, we can divide the different lobes of the cerebral hemisphere. Now look this. The part of the cerebral hemisphere anterior to the central sulcus. This is the central sulcus. So the part of the cerebral hemisphere anterior to the central sulcus, above to the posterior MS of the lateral sulcus. This part is the frontal lobe of the cerebral hemisphere. So the limitation of the frontal lobe of cerebral hemisphere anterior to the central sulcus, the area of the cerebral hemisphere anterior to the central sulcus, look this color, above to the posterior MS of the lateral sulcus. This is called the frontal lobe of the cerebrum. The area of the cerebral hemisphere posterior to the central sulcus and behind by the first imaginary line, anterior to the first imaginary line, this green color, that is the parietal lobe. That is the parietal lobe. This one. And the area of the cerebral hemisphere behind this first imaginary line, that is the occipital lobe. That is the occipital lobe, and the area of the cerebral hemisphere below the posterior MS of the lateral sulcus, that is the temporal lobe. So by these imaginary lines, we can divide the different lobes of the cerebral hemisphere: frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Now we will consider each lobe and their sulci. See first one, the frontal lobe. Now the next thing, rather calling anyone, I will stop the class. What do you want? Why are you doing the murmuring? The student who are not interested can go, but don't disturb the others. Now look here in the frontal lobe. The sulci of the frontal lobe, first one is the central sulcus. Just anterior to the central sulcus, look the another sulcus. This sulcus is called precentral sulcus. The precentral sulcus running parallel to the central sulcus on the superolateral surface. Look here. This is the precentral sulcus and reaching just above the part of posterior ramus of the lateral sulcus. I am talking of this. The gyrus present between the central sulcus and precentral sulcus. This is the prefrontal gyrus. Look here. This is the precentral sulcus, this is the central sulcus. The gyrus present between these two, the precentral gyrus, and next anterior to the central precentral sulcus. You are seeing here the two horizontal lines. These are the superior frontal sulcus, inferior frontal sulcus, and the gyri present between them, or these two parallel running sulci in the frontal lobe. They divide this into three parts: superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. In frontal lobe, these are the different sulci. First is the central sulcus. Anterior to the central sulcus, there is the precentral sulcus. That is this one. The gyrus present between the two is called precentral gyrus. That is this part. Just anterior to the precentral sulcus, there are the two horizontal lines. The upper one is called superior frontal sulcus and the lower one is called inferior frontal sulcus. The gyri present between them, superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. Okay. Now look the inferior frontal gyrus. In the inferior frontal gyrus, you are seeing the rami of lateral sulcus, anterior ramus, ascending ramus, and posterior ramus. The part of the inferior frontal gyrus between the lateral sulcus and A, this is called pars orbitalis. A is called pars orbitalis. B, the area between the A and B, that is this one, pars opercularis, and the part that is pars triangularis. Then we come to the part of parietal lobe. In the parietal lobe, the sulcus is just posterior to the central sulcus, or running parallel to the central sulcus. There is another sulcus, and this is called post-central sulcus. The gyrus present between the central sulcus and post-central sulcus, that is called post-central gyrus. The precentral gyrus is for the motor area and this is for the sensory area. I am talking of this part. And besides this post-central sulcus, in the parietal lobe, there is present another, a single horizontal line, sulci. I am talking of this. This is called interparietal sulcus. This interparietal sulcus divides this parietal lobe into the superior parietal lobule, that is this one, and this is the inferior parietal lobe. Then come to this part, occipital lobe. In the occipital lobe, you are seeing the two important sulci. Look here, this is called lunate sulcus, lunar shape. I am talking of this. The lunate sulcus is present anterior to the occipital pole, and just anterior to this, there is present the transverse parietal lobe sulcus. Then come to the part of temporal lobe. In the temporal lobe, there is present the two horizontal sulci, the superior and inferior, and they divide this temporal lobe into the superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. Now I am telling you here the important parts. Look the posterior end of the posterior ramus of the lateral sulcus. This one, okay, and this is the part of the superior temporal sulcus, and this is the inferior temporal sulcus. These parts, they are reaching into the part of inferior parietal gyrus. The posterior ramus of lateral sulcus, and that is this one, posterior ramus of the lateral sulcus, where it is present. What is this part? Green color. Inferior parietal gyrus, and similarly the superior temporal sulcus is also reaching here, and the inferior part. So the area of posterior ramus of the lateral sulcus, that is this one, and the part of the superior temporal sulcus and inferior temporal sulcus reaching here. And this area we will talk, this is called supramarginal gyrus. Supramarginal gyrus. The posterior ramus of lateral sulcus which is reaching into the inferior parietal gyrus. That is supramarginal gyrus, called supramarginal gyrus. And similarly, the superior temporal gyrus which is reaching here, that is called the lingual gyrus. Sorry, angular gyrus, not lingual. Angular gyrus. And third one, that is this part which is inferior temporal sulcus, that is forming orcus temporo-occipitalis. This is the part of temporal lobe, this is the part of occipital lobe. So this is forming the orcus temporo-occipitalis. So these are the different sulci and gyri on the superolateral surface of frontal, parietal, and this. Now I am coming on to the medial surface. On the medial surface, when we see the medial surface of the cerebral hemisphere, whether you want to see or not, your eyes will go towards this part. This is corpus callosum. This corpus callosum is having the different parts. Anterior part, this is the genu, and this is the trunk, D, and this is the splenium part of corpus callosum. The corpus callosum consisting of commissural fibers that you will read in the next class, 5 fibers. These commissural fibers connecting the two cerebral hemispheres, they connect the two cerebral hemispheres together. And below this corpus callosum, there is present the third ventricle. That is this part. Another thing which you will see here, this is septum pellucidum. the septum pellucidum is separating the lateral ventricle, two lateral ventricles from each other. As I told you, the cavity of the cerebrum hemisphere is the lateral ventricle. The two cavities having separating from each other by the septum pellucidum. And another point which you will see here, below the septum pellucidum, look this part, which is attached above to the corpus callosum and coming downward, reaching just anterior to the anterior commissure. This is called the fornix. The fornix is consisting of projection fibers, commissure fibers, many things that we will talk later on in separate class. So this is the fornix. And below this fornix, look this green part. This is the part of the thalamus. And below the thalamus, you are seeing this line, and below this line, this part is of hypothalamus. This part is of hypothalamus. So, when we see the medial side of the thalamus, we will find the another cavity, that is third ventricle. So third ventricle is present on the medial side of the thalamus, or you can say that the lateral wall of the third ventricle is formed by the thalamus. Below this, come to this part. The third ventricle is continued downward below this cerebral aqueduct. This is cerebral aqueduct. And through this cerebral aqueduct, look here, what is this part where the cerebral aqueduct is present? In the midbrain. And through this cerebral aqueduct, the third ventricle is continued with the fourth ventricle. That is this one. Is continued with the fourth ventricle. And look above part. As I told you, this is the part of third ventricle, and anteriorly the anterior wall that I will show in the next diagram. There is the interventricular foramen. Through this interventricular foramen, the third ventricle is continued with the lateral ventricle. Alright. So these are the important parts of the medial surface. Besides this, see the important sulci. The corpus callosum, which is present in the sulcus, that sulcus is called the part of callosal sulcus. Callosal sulcus, where the corpus callosum is present. And just above the callosal sulcus, you are seeing this good sulcus. This is called cingulate sulcus. I am talking of this. This is called gyrus cingulate sulcus. You are seeing this line, curved line. This is the cingulate sulcus. Now look, the gyrus present between the, what is this? Corpus callosum. As I told you, corpus callosum is also having the sulcus, that is called callosal sulcus. And above the callosal sulcus, this is the cingulate sulcus. The gyrus present between these two, that is called cingulate gyrus. So this is the cingulate gyrus. And above this cingulate sulcus, this area is called medial frontal gyrus. This one. This is the medial frontal gyrus. I am telling you again. See, on the medial surface, you will find just above the corpus callosum, you will see the good sulcus. And this sulcus is called cingulate sulcus. The gyrus present between the cingulate sulcus and corpus callosum or callosal sulcus, that is this one. This is called cingulate gyrus. This is the cingulate gyrus, and above this sulcus, this is the medial frontal gyrus. So this is the area medial frontal gyrus. And just go posterior to the medial frontal gyrus. You are seeing here the part of the central sulcus line. You can see here the central sulcus line. The gyrus surrounding this central sulcus here, that is called paracentral lobule. And this paracentral lobule is very important part nowadays because this is the center for defecation and micturition. Paracentral lobule. So what is the paracentral lobule? That is the gyrus surrounding the central sulcus on medial surface. This one. On the posterior surface, look the posterior surface on medial surface. You are seeing this blue color area. One, this is the parieto-occipital sulcus. And look downward. Here, you are seeing the another sulcus. This is the calcarine sulcus. So the area or the gyrus present between the parieto-occipital sulcus above and calcarine sulcus below, this is called cuneus. Cuneus, C-U-N-E-U-S. Now, before talking of the inferior surface, look here. This part is not clear to the student. This is the inferior surface of cerebral hemisphere, both the cerebral. Okay. What is this? Optic chiasma. Look this part. This is optic chiasma. This is the part of midbrain. Okay. And these are the part of optic tract. Okay. Now the parts, the area posterior, which is bounded anteriorly by the optic chiasma, laterally by the optic tract, and posteriorly by the crus cerebri of the midbrain, this is called interpeduncular fossa. Interpeduncular fossa. So what is the interpeduncular fossa? This thing should be clear in our mind. The area posterior to the optic chiasma. You can see the diagram. This is optic chiasma. Just posterior to the optic chiasma, that is, look this area. And anterior to the crus cerebri of the midbrain. This is the midbrain. Okay. And bounded laterally by the optic tract. So this area is called interpeduncular fossa. The contents of the interpeduncular fossa, see this diagram, I will show you again. You are seeing here the two rounded structures. These are the mammillary bodies. These are the mammillary bodies. And just posterior to the mammillary bodies, this is the part of posterior perforated substance. And anterior to the mammillary bodies, there is the tuber cinereum, that is the of ants. And they are also forming floor of tickle. Alright, I will come again, don't worry. Look here the inferior surface. You are seeing here the two colors. See this part of the cerebral hemisphere. This is the blue color and this is pink color. My point is this, that inferior surface of cerebral hemisphere is dividing into two parts by stem of lateral sulcus. As I told you previously, the stem of lateral sulcus is on inferior surface of cerebral hemisphere. Look here, what is that? This one. Listen carefully. You will not understand. This is the stem of lateral sulcus, and this stem of lateral sulcus dividing this inferior surface into two parts. Anterior to this smaller part, this is the orbital part. This is the orbital part of inferior surface. and this is the tentorial part of the inferior surface. So the stem of lateral sulcus, dividing this inferior surface into two parts. The smaller anterior part is the orbital part and the larger posterior part is the tentorial part. See the orbital part. On the orbital part, very clearly you are seeing the sulci. This is the orbital sulcus, olfactive sulcus, and in the olfactive sulcus you are seeing lying the olfactive bulb, and below the olfactive bulb you can see the olfactive tract. Olfactive and olfactive, they are present in the anterior orbital part, that is this part. Olfactive bulb, olfactive tract. As the olfactive tract comes posteriorly, it divides into two branches. Look here. Olfactive tract, as it comes posteriorly, divided into two parts. And the masses of blood vessels, they are present inside the two parts of it, that is called anterior perforated substance. Anterior perforated substance, that is this one. One sulci is the olfactive sulcus, that is this one. Look another part. You are seeing the another line. This line is H-shape or not? The second line is S-shape or not? This S-shaped line dividing this rest of the part of orbital surface into anterior orbital gyrus, posterior orbital gyrus, medial orbital gyrus and lateral orbital gyrus. Then come to the part of tentorial part, that is this one. Here again the two sulci. One is the medial one. The medial one sulcus is the collateral sulcus, that is this one. And lateral is the parieto-temporal sulcus. Now you can understand more betterly by this diagram. This is the olfactive bulb, olfactive tract, and it is dividing into two parts here, and this is the anterior perforated substance, and this is the S-shaped sulci. And this one, this demarcation you can see here, this is the stem of lateral sulcus. So the stem of lateral sulcus dividing this inferior surface into sulcus, lateral one, and medial one, this is the collateral sulcus. This is the collateral sulcus. Now, the gyri present between the, on medial side of the collateral sulcus, I am talking of this. This is the parahippocampal gyrus. Parahippocampal gyrus. And look the parahippocampal gyrus, as it goes anteriorly, it is forming here the hook-shaped structure. This hook-shaped structure is forming the uncus. And uncus is the site for olfactive center. That I will talk later on. Area number 28. Uncus. So uncus is the hook-shaped structure or anterior part of the parahippocampal gyrus, and that is this part is the parahippocampal gyrus. Now look the another part. This is the occipitotemporal sulcus. So the gyrus present between occipitotemporal sulcus and collateral sulcus, that is medial occipitotemporal gyrus, this one, medial occipitotemporal gyrus, and the gyrus present on the lateral side, that is the lateral occipitotemporal gyrus. See the another part. What is this? Collateral sulcus and On the medial side, there is a small part of calcarine sulcus. The calcarine sulcus is present on the part of occipital lobe on the medial surface. On the medial surface, I told you about two sulci. One is the parieto-occipital sulcus, another is calcarine sulcus. The gyrus present between the two is called cuneus. And this calcarine sulcus is slightly reaching here on the medial side. This is the part, the area between these two, or the gyrus present between these two, that is called the lingual gyrus. This link with you, all these are concerning with the limbic system. The parahippocampal gyrus, uncus, lingual gyrus, all they come under the head of the limbic system. That we will take in short. So, these are the different parts. Now come to the another part. The functional area I will tell you on next class, not today.